Hi, I'm Robin, Nurse Navigator at the Nebraska Spine Hospital. We're talking about instructions or activity restrictions for at home, and these are general instructions for all spine surgeries. If your surgeon has told you any more specific instructions, please follow your surgeon's instructions. Some of the restrictions at home are no heavy lifting at home. And if you are carrying a gallon milk, carry it close to your body. It puts a lot less stress here on your back, a lot more stress if you carry that gallon of milk far away from you. Other restrictions would be no heavy housework, yard work, chores, snow removal. And the other thing is to sit up straight. Limit your sitting. We say limit your sitting to 30 to 60 minutes at a time. Some surgeons are a little more particular, so it's important to listen to your surgeon on the specific time amount. But between 30 and 60 minutes is a safe time to sit. And the important thing with sitting is to sit up straight. You want to sit up nice and tall and straight in the chair. You would not want to slouch down in the chair. So sit up tall and straight. Other restrictions would be to avoid the BLT, and I don't mean bacon, lettuce, tomato. You can freely have a bacon, lettuce, tomato sandwich. But we don't want the BLT, the bending, the lifting like I just talked about, or the twisting. So instead of twisting your spine to look around behind you, you'd want to turn your whole body. Okay? And the other thing is the stooping over. Instead of stooping over at your back area, you'd want to bend your knees and squat down to pick up an item versus bending or stooping over. If you have stairs in your home, it is okay to go up and down the stairs, but it's probably best to avoid the stairs if you can. But if you can't, for example, if your bedroom is up or downstairs, it is okay to do the stairs, but probably a good idea to limit the number of times you do the stairs. If you're doing the stairs, go slow, hold the handrail, and if you had a leg that was a problem before the surgery, we'll label that the bad leg. If it was painful, numb, tingling, weak, we'll label that the bad leg. And it's best when you're going up the stairs to lead up with your good leg. And then when you're going down, lead with your bad leg. So it's up with the good, down with the bad. After the surgery, we definitely want you to do some walking. The distances for walking would be walk similar distances that you walked while you were in the hospital, and then gradually increase those each day. A good goal about 4 to 6 weeks after the surgery is to reach for 1 mile a day of walking. And it's okay to break that down into 2 shorter walks to equal that mile. Home health equipment after your surgery, there's not really a lot that all patients will need. It really depends on the patient. But I'd say some helpful devices would be the reacher, those little reachers that you can pick up stuff with. Not needed, but a helpful tool. And you can find those ahead of time of surgery. You can find those at any pharmacy. Even you can order those on Amazon Prime. Another piece of possible equipment could be a raised toilet seat for somebody having lumbar or low back surgery. If you're on the taller end, 5'10" or taller, and I'm 6'1", so I would find that a helpful piece of device. But not always necessary. These are kind of considered luxury items, so insurances aren't going to typically cover those. But it might be very helpful if you are taller. The other piece is a shower chair. If you're real weak or fatigued before surgery, taking a shower might wear you out. So a shower chair might be helpful for somebody having a lower back surgery, but not necessary for everybody. One other piece of equipment that is nice is just a nice chair, and typically a chair with some handles or rails on it to help you push up or rise off. Not needed, but most of us will have just a chair in our home that has some of these handrails on them. If you use a cane, walker, wheelchair, or brace before your surgery, please bring those items with you to the hospital, and we'll reevaluate you and see if you still need to use those after the surgery, and we'd give you instructions on how to use those items. You will have a follow-up appointment with your spine surgeon after the surgery. Typically it's anywhere from 2 weeks after the surgery, and it could be as long as 6 weeks after the surgery. And we will give those instructions to you on your paperwork before you leave the hospital. Thank you for watching this video on recovering at home. If you have any questions, please jot them down and ask your nurse navigator. We'd be happy to answer any of your questions.